Bismillah ar-Rahman Rahim. We're starting off with the third section from the unit stress, and this is managing stress. If we have a closer look at this, we see that the syllabus for this particular section is divided into three different bullets. Through the first bullet, we'd learn psychological therapies, where we would be discussing uh, biofeedback as a way through which stress can be managed. And while we'll be covering this, we would be discussing this example study by Budzynski et al. In 1969. And after that, we'd discuss the second bullet. If you have a look at the second bullet, we have the use of imagery to reduce stress. So the first thing that needs to be done over here covered is biofeedback. And the second one is imagery, the use of imagery to be able to reduce stress. And this is exemplified through a key study. And since you all know that every unit, every chapter that we have has a key study, and anything and everything that is there in the key study needs to be done and done well. And you could get questions related to almost anything and everything related to key study, relating to the key study. So while we'll be covering this key study is on relaxation and imagery in reducing stress during medical treatment. And this was conducted by Bridget all in 1988. Uske baad, third, we are to discuss how you can prevent stress from happening. And over here, we discuss stress inoculation training by Mission Bomb. So three different bullets that we see here. And can you get a direct question on stress inoculation training? Yes, you can, because even when we do not have any example study under this bullet, the examiner or the paper setter mentioning the term stress inoculation training in this syllabus means you can get tested on this tomorrow in the CIEs. Now, taking this ahead, if we quickly have a look at the relevant issues and debates and methodology for this topic include: number one, application to everyday life. The first one is application to everyday life. The second one is individual and situational explanation. The third one is determinism versus free will. The fourth one is generalization from findings. And the fifth one is ethics. So let's take this ahead. Bismillah ar-Rahman rahim. We are discussing psychological therapies to help us understand how stress can be managed. There are several different ways to manage stress. They include biological treatments too. And as we speak about biological treatments, you could use anti-anxiety medications to be able to manage stress, reduce stress. And along with biomedical treatments, you also have psychological treatments or psychological methods that are very often used when it comes to managing stress. And to begin with, we have biofeedback, and number two, we have imagery. As we speak about biofeedback and imagery, biofeedback, as the name suggests, it is a technique that is used by individuals through which you try to control certain bodily functions. Now, how is it that you try to control certain bodily functions? You try to control them by receiving feedback from your body. Now, if I may give you a simple example here, if you keep on getting to know as to how your body is responding, or how your body is coping up with whatever you're going through at that particular moment, that gives you uh, that information that you receive helps you manage, if not control or reduce, stress in a better manner. A simple example: the smartwatches that are worn these days, they indicate us if we have if our resting heart rate is going higher. This right or correct information getting at the correct time, this can actually help you keep a better check on your body. And at the same time, this can help you manage your stress better. So biofeedback kya hai? Biofeedback is a psychological therapy that is used to manage stress. It is a technique that teaches individuals how to control certain bodily functions, such as your heart rate. See, you'd be able to control your heart rate once you know what your heart rate is at that particular moment. And there are different ways that you could use to do this, such as muscle tension is one of the way. This is done usually through electrical sensors that provide feedback about your body. For example, through a monitor or a beeping sound. For receiving this feedback, individuals can learn to make changes such as relaxing the muscles or slowing their breathing. So different ways that are used later on. So different ways that are used later on once you understand how the mechanism, or once you understand how this biofeedback works. एक बेसिक आइडिया, आपकी बॉडी से रिलेटेड आपको जब इंफॉर्मेशन मिलती रहेगी, आपको पता, अगर आपका हार्ट रेट बढ़ गया, अगर आपको पता चल रहा है सही टाइम पे अगर आपका हार्ट रेट बढ़ा पाए, तो देन यू वुड बी एबल टू टेक नेसेसरी एक्शंस, और that there could be several, there could be many, there are plenty of them, and this would eventually help you uh, have better control over your body. So the keyword over here is feedback, you receiving the right, correct feedback at the right time. Biofeedback usually requires initial training from a specialist, but the goal is for individuals to eventually use the technique on their own. Overall, biofeedback, so when we're talking about training individuals or making individuals independent so that they are able to not only learn this technique, but use it whenever required on their own, this uh, this is a plus point, and this is an advantage that you have, which again, if you remember, if let me just show it to you, you had the application of psychology, the application to everyday life uh, issue in the syllabus mentioned under the heading of managing stress. तो आप ये कह सकते हैं कि this is a plus point, or this is an advantage when it comes to using biofeedback. Overall, biofeedback can improve health by reducing stress, anxiety, by reducing stress, anxiety, high blood pressure, pain, so on and so forth. Now, taking this ahead, let's talk about this example study that was conducted by Budzynski et al. This example study was conducted in the year 1973, and it's super simple. Again, based on the same mechanism, you receiving feedback, and feedback in this case was through sound, through a tone, and through this tone. And of course, the participants, there were 15 participants in this research, which again is not a very good thing, because again, let me take you back to the syllabus. If you see यहाँ पे syllabus में आपके पास generalization from the findings, if you're conducting a research that only has what, 15 participants, the extent to which you can the extent to which you're confident that you can apply the findings on the general population might be questionable. So Budzynski et al. Wanted to assess the effect of biofeedback in reducing tension headaches. So what is the goal here? They're trying to assess the effect of biofeedback. किस हद तक biofeedback का आमद है when it comes to reducing tension headaches. Tension headaches are associated with sustained contraction of the scalp and neck muscles. Therefore, relaxing the frontal muscle will have a positive impact on reducing the suffering of a patient. So, relaxing the frontal muscle will have a positive impact on reducing the suffering of a patient. So, here, we're talking about tension headaches, and they're associated with what? Sustained contraction of the scalp and neck muscles. And the idea is that if you're able to relax the frontal muscle, this would have a positive impact, and this would eventually help the individual control or manage the stress better. So, procedure, each participants had electrodes attached to their forehead and 1 inch above their eye across the forehead. There were 3 conditions over here in the experiment, and each of the 15 participants were randomly allocated to one of the 3 conditions. Now, to begin with, like I had said a couple of minutes earlier, there were 15 participants in total, and this we would refer to as an independent measures design. Why is it that I'm using the word independent measures design here? Because अलग-अलग participants अलग-अलग experimental conditions से go through करेंगे. Different participants would go through different experimental conditions here. And in this particular experiment, there is 1 experimental condition and there are 2 control conditions. 3 conditions in total, 3 IVs in total. We have 1 experimental condition and we have 2 control conditions. I'll tell you what they were like. So again, if you did notice, the participants, they were allocated to different groups randomly, and if you're randomly allocating participants to different groups, this again adds to the validity of the research, which again is a plus point. So taking this ahead, the experimental group were told that the pitch of the tone, now we're starting off with the experimental group first. The experimental group were told that the pitch of the tone would vary with the level of muscle tension. So you are training participants to be able to relax their frontal muscle, right? And the information that you're providing these participants is that the more relaxed, the more they're able to, what do you call it, relax the frontal muscle, the more they're able to relax their what do you call it, frontal muscle, the lower the pitch of the tone would be. So the idea is there are electrodes that are attached, right? There are electrodes that are attached to the head, 1 inch above the eye across the forehead here, right? And you in the first condition, that is the experimental condition, you're telling participants, you've informed participants that there'd be a tone that they'd have to hear, they'd be hearing, and as they'd be a part of this experiment. And the more they're able to relax their frontal muscle, the lower the pitch of that tone would be. आम जबान के अंदर जितना आप अपने frontal muscle को relax करेंगे, उतनी ज्यादा जो टोन आप सुन रहे हैं वो कम होती जाएगी, ठीक है? So if the tone is varying, if the tone is reducing, or if the tone is getting low pitch, that again is an indication to you, that again is a feedback to you that you're doing what you were supposed to do. So the experimental group were told that the pitch of the tone would vary with the level of muscle tension in the forehead. They were told to relax and as deeply as possible and to keep the tone low pitched. So this is the experimental group that we're talking about. Taking this side, if we speak about control conditions, there were two control conditions that were used in this study as well. The constant low tone, irrelevant feedback. Now, understand this. Constant low tone, irrelevant feedback. What does this mean? Now, in the second condition, these, remember, there were 5 participants over here. Now, I'm talking about the next set of 5 participants who were in the second condition, which is a controlled condition. These participants, they were told that they'd have to listen to this constant tone, but the constant tone with we're referring to this as the constant tone irrelevant feedback group. Now, why is it that we're using the word irrelevant feedback? Because the tone would not vary. So the constant tone would just be there. And there was deception involved here because the participants were told that this constant tone is there because this is to help the participants, and this constant tone is there because it's going to help the participants relax better. But then again, this was deception and the tone did not change. And of course, the tone did not give you any indication either. So the constant low tone irrelevant feedback condition was told to relax deeply, especially the forehead muscle. They were also told that the constant tone should help them relax. Deception. The third group, see, the first group, the second group, and the third group, right? So 1 experimental groups, 2 control groups. The final group, they were told to relax as deeply as possible, and they were asked to do this in silence. Now, let me walk you through this real quick. 3 conditions are what we're talking about over here. The first condition, the experimental condition, participants would listen to a tone, and they have instructions now to relax their frontal muscles as much as they can. And the more they're able to relax their frontal muscles, the lower the tone of the lower the pitch of the tone would be. So if the pitch of the tone keeps on reducing, getting decreasing, that is an indication that you are successful in keeping your frontal forehead muscles relaxed. The second condition, that was a control condition, they were made to listen to this constant tone, which did not have any feedback there. And these participants, they were asked to relax as deeply as possible, and they were asked to specially relax their forehead muscle, and they were deceived that this constant tone that they made to listen to would help them relax better. And then there was this third group. This third group, they were this I'd say was a control group in its true essence. They were simply asked to stay silent. I'm sorry, they were simply asked to relax their frontal forehead muscles, and they were supposed to do this in silence. So 5 participants in each group, total 15 participants, and these participants were randomly allocated to the conditions. The results were collected over 5 sessions, and the mean level of muscle tension was measured to operationalize the dependent variable. So what is the DV here? The DV over here is the mean level of muscle tension. And This is what was what do you call it? This is what the DB was. ठीक है? IVs हमारे पास तीन थे ये. Now taking this ahead, if you have a look at the results of the research in terms of decrease in muscle action potential from baseline to the end of the trial, it was evident that those participants in the feedback condition saw a significant reduction in the muscle tension. Now, again, as expected, the experimental group was the group that experienced uh, experienced a significant change, a change in the sense that they were able to, or they were successful when it came to relaxing their muscles, and they were able to do this. But the point that Budzynski et al. Are trying to make over here is they were able to do this because they were getting a feedback, and that feedback in this case, I've said this three times uh, earlier as well, was that the pitch of the tone kept on reducing. Now, let's take this ahead. Bismillah ar-Rahman ar-Rahim. Yeah, tension over the course of 5 sessions, and this reduction was greater than the two control groups. The experimental group had decreased by 50%, for the constant tone group 28%, and for the third group, which was expected to try to relax their muscles in silence, for them it was 24%, and the difference is very evident here. Now, if you have a look at the usefulness of this study, the study showed that the patients can be trained to voluntarily lower the muscle through the use of biofeedback, as the numbers that we have in front of us did show us that it works. The study suggests that conditioning techniques and shaping of behaviors could be applied to a wide variety of physiological events in the body. The practical implication of these results would seem apparent. Biofeedback can have beneficial effects of profound muscle relaxation in alleviating a number of anxiety and stress-related disorders. Quickly having a look at the strengths and limitations for this research. The procedure was kept standardized. If you keep the procedure standardized, that makes it easier for you to be able to replicate your research. And as you're replicating the research, this increases the chances of reliability. One. Number two, like we discussed, this could be really useful because this correct feedback that you're receiving, like I had said right at the beginning, this helps you that this helps you control your body better, and yeah, knowing more about your body would help you control the body better as compared to you not receiving feedback. If we talk about the weakness, like I discussed earlier, since there were only 5 participants in each condition, you cannot really be sure about the extent to which you can generalize the findings of this research. So yeah, if anyone wants to take screenshots of this show, go ahead. This is the example study that was conducted by Budzynski et al. 1973. This is the second slide for it. Now, taking this ahead, Bismillah ar-Rahman ar-Rahim. Let's talk about using imagery to reduce stress. Let me take you back to the syllabus and let's see this. Now, this part we're done with, the first bullet we're done with. Now we move on towards the second bullet, that is the use of imagery to be able to reduce stress. Now, as we speak about the use of imagery here, imagery, you've studied this earlier numerous times as we've been covering our syllabus. And taking this ahead, Bismillah ar-Rahman ar-Rahim. Another psychological therapy used to manage stress is imagery. What exactly is imagery now? Imagery involves creating mental pictures of calm and relaxing situations, such as a beach, mountains, or any place the individual finds peaceful. Or let's just say for you, imagining that you are done and through with your CI examination and you're enjoying your summer break, and you've had permission from your parents to travel wherever you want to, and they funded for that. So the aim of imagery is to reduce stress by helping individuals focus on positive and soothing thoughts instead of stressful ones. So while you're going through something stressful, you mentally picture something that helps you stay calm, that's something that helps you relax better. As simple as it could be, imagery comes from the word imagination. So again, there would be individual differences. There'd be some people who'd be better at imagination as compared to others. And at the same time, there'd be some people who would who might struggle learning how to go about with this. So the brain often responds to imagined situations in a similar way to real experiences. So imagining a relaxing scene can lead to real physical changes, such as a slower heart rate, relaxed muscle tension, and feeling of calm. Now, these could be the positive physiological outcomes. Imagery is commonly used in cognitive and behavioral therapies where individuals are trained to replace negative or stressful thoughts with positive mental images. It can also be guided by a therapist or done independently as a relaxation technique. Overall, imagery helps manage stress by changing both the psychological experiences and the physiological response to stress. So, in a nutshell, you are trained, you're taught, and then trained and made to practice imagining a scene, mentally picturing something that helps you relax while you're going through something that is stressful or potentially stressful. Now, taking this ahead, Bismillah Rahman Rahim, here, like something like this, maybe. Okay. Now, this study that we have in front of us was published in 1988, and this study was conducted by Bridge et al. And this is a key study. Here you go. Key study on relaxation and imagery in reducing stress during medical treatment conducted by Bridge et al. In 1988. Now, what is this research about? This is about using relaxation and imagery in treatment of patients who have cancer. Now, taking this ahead, this is all we'd be discussing. From context to the main theories and explanation, to the aim, to the study sample, to study design, followed by the results. If you talk about the context of this research, I think it's very evident. The moment you hear the word cancer in itself carries a lot of stress. God forbid if you get to hear about someone who has cancer, that doesn't leads to, in most cases, that leads to individuals not feeling very good about it. Imagine someone who gets to know about uh, who's imagine someone who's been diagnosed with cancer. Imagine the amount of distress and anxiety and stress that they would be experiencing. So the treatment they may have to go through an uncertainty about the future. So patients often feel anxious about the symptoms, one, the treatments they may have to go through, and the uncertainty about the future. You know, yeah. So I think all of you know what cancer is, and all of you do have an idea about how bad cancer is. So, as McGuire suggests, patients may feel losing their health, their usual role in life, and even their life itself. Dealing with cancer treatment is already very challenging for both the patient and their family. Therefore, reducing the stress linked to the illness can be very beneficial. If stress is managed effectively, patients may develop a more positive outlook and have greater emotional strength to cope with the condition. So, if you're successful in helping the patient be able to manage this stress well, they would be in a better position to be able to cope up with their condition. This emotional strength that they'd have can help them cope up with the situation better. So taking this ahead, research has shown that relaxation imagery can help reduce stress in people with different illnesses, including cancer as well as other conditions such as hypertension. For example, Simonton found that imagery techniques can support patients in managing stress more effectively. So we have one reference over here in the background. We have another reference here. Taking this ahead, Bismillah Rahman Rahim, let's move on and talk about the main theories and explanation. So main theories and explanation, of course, this was about imagery. This was about muscle relaxation and progressive muscle relaxation techniques, imagery with progressive muscle relaxation techniques being taught with the intent of helping participants imagine better, mentally picture something that keeps them calm better, and consequently resulting in them being able to manage their levels of stress better in situations or yeah, in situations that are bad, like being told or getting to know that someone has cancer. Relaxation techniques reduce stress by helping the body become physically calm through muscle relaxation, one, and deep breathing. Slower breathing reduces heart rate and tension, leading to a calmer state. One method is progressive muscle relaxation, where individuals tense and then slowly relax different muscle groups, focusing on the feeling of release. Deep breathing is also important as slow, controlled breaths help reduce anxiety. So, one way you do this, that is progressive muscle relaxation. The second one is deep breathing. Simple. Another technique that is used is imagery, and over here, which involves imagining a peaceful and safe place to create feelings of calm. The individual is encouraged to picture this place in detail using their senses. Using these techniques together can effectively reduce stress and promote relaxation. So we uh, are talking about using progressive muscle relaxation. We're talking about using deep breathing and imagery. Taking this ahead, having a look at the aim of the study real quick. The researchers aim to investigate the effect of relaxation and imagery on stress in cancer patients. They hypothesized that both relaxation and imagery would reduce stress compared to patients who did not receive any treatment. Now, this is an example of a directional hypothesis. They also predicted that patients who used both relaxation and imagery together would show a greater reduction in stress than those who used just relaxation alone. So, two directional hypotheses where the researchers they predicted that relaxation along with imagery would help participants who did not receive any treatment at all. And number two, if you talk about a comparison between relaxation and imagery, दोनों methods को अगर आप आपस में compare करते हैं तो it was the researchers also hypothesized that relaxation and imagery together compared to relaxation being used alone would be better. Taking this ahead, if you have a look at the sample of the research, this would be referred to as a gynocentric research because this involves only female participants. There were 139 women who had been diagnosed with early breast cancer and were receiving a 6-week course of radiotherapy. So we're talking about real patients because we're talking about real patients here. The extent to which we can apply the findings of this research on uh, other cancer patients is high. One, number two, that's an advantage. But if we talk about a disadvantage, because in this research, the participants that the participants were patients who were diagnosed with breast cancer. We only had females as participants in this research, which again makes it arguable about the extent to which the findings of this research could be applicable to males. Now, receiving a 6-week course of radiotherapy as outpatients, all participants were under 70 years old and attended a hospital in London, UK. So again, cultural differences could be used. They were informed that they were randomly assigned to one of the three groups. All participants completed mood questionnaires at the start of the study. So how is it that data is being collected here? Initially, we talk about these mood questionnaires. Questionnaires, remember, are examples of self-report measures, and all the advantages and disadvantages of self-report measures should be considered and kept in mind as we proceed. They completed mood questionnaires at the start of the study after the first radiotherapy and again after the 6-week program. So for now, let's note the information that we've received. Having to fill mood questionnaires at the start of the study, that is after the first radiotherapy session, and again after the 6-week program that they were a part of. The study design, participants were divided into 3 conditions. The first condition was the control group. They received no treatment. The second one was, they were receiving treatment for the cancer. We're talking about treatment, no treatment over here in the context of them being helped to manage their stress. The second group was only made to go through relaxation techniques, and the third group had was made to go through relaxation plus imagery. And in this case, if we talk about there are 3 conditions we're referring to over here. And if we talk about independent variable, these would be the three independent variables. And if we talk about the experimental design used over here, experimental design, no, sorry. Experimental design, it was independent measures design that was used. Now, what is independent measures design? When different participants are made to go through different experimental conditions. So how many participants did we have over here in total? We had 139 participants. They were all females. They were participants who were a part of a 6-week course of radiotherapy, and they were cancer patients. All of them were under 70 years, and they were recruited, or they were picked from a hospital in London, the UK. The two treatment groups. Now, these two groups, I'd like to refer to these both as the treatment groups here. The two treatment groups were taught relaxation techniques, including focusing on different muscle groups and practicing deep breathing. The relaxation plus imagery group, this group, also learned to imagine a peaceful scene to enhance relaxation. Participants in the treatment groups were given a 15-minute audio recording. Having a look at the procedure, they received a 15-minute audio recording to practice daily. All participants met with a researcher once a week. So we see all participants, that shows us there was standardization. All participants met with a researcher once a week for 30 minutes over 6 weeks. The treatment group practiced their technique, while the control group simply talked about general topics. So their techniques differed too. There was this second group was only taught to relax, and the third group was taught to relax and imagine at the same time. Stress and mood were measured using two questionnaires. Number one, profile of mood state. We may also refer to this as POMS. This assessed mood factors like tension, fatigue, anger, and confusion, giving an overall mood disturbance score. If we talk about score being used over here, we are referring to quantitative data being collected. Number two, the Leeds general scale. This measured levels of anxiety and depression, measuring levels of anxiety and depression using a short rating scale. So again, if we are referring to a rating scale again helps us gather quantitative data. Number three, these measures allowed researchers to compare changes in stress across the three groups. So I want you to learn this and this. Taking this ahead, having a look at the results of this research real quick. The results showed that the total mood disturbance score was significantly different across the three groups, although this was not found for the Leeds general score. So the difference was found here, but not here. You'd have to learn this because this is a key study. So I'd want to show you content from your book as well that would help you understand or know better, or at least have an idea about what all the content is there that the book has. As expected, mood improved in both the relaxation group and the relaxation plus imagery group after 6 weeks, and greatest improvement in the relaxation plus imagery groups. So if you remember, there was a directional hypothesis that was used by the researchers. The researchers were expecting that a relaxation plus imagery group would be the one that would experience the significant difference, and they would feel more relaxed and the mood would be better. So mood improved in both the groups, the relaxation group and the relaxation plus imagery group. This was one of the IV, this was another IV. After 6 weeks, with the greatest improvement in the relaxation plus imagery group, and this was again as hypothesized. In contrast to the control group's mood actually worsened over the same period. Further analysis showed that both treatments were more effective for women aged 55 and above. So again, a factor that mattered over here was age, and it was seen that elderly women, this worked better, or this was more effective for elderly women, particularly in reducing depression and tension. However, women who had high levels of anger at the start did not benefit as much. Now, what do we learn from here? That individual differences. So women who had anger issues, high levels of anger at the start did not benefit as much. Possible because their anger made it harder for them to engage with the relaxation technique. See, these are psychological techniques that you use, and they are they're very demanding. You are to in this particular research for this particular research you had to relax, and if you're not ready to relax, you cannot. But of course, if that helps. Overall, the findings suggest that relaxation, especially when combined with imagery, is effective in improving mood and reducing stress. Now, let's evaluate this, scrutinize this real quick. The study by Bridge et al. Used a reasonably large sample. The sample was decent enough. If you remember, I'd shown this to you right at the beginning. There were 139 women, but all participants were women. So this could be a plus point. Whereas if you talk about all the participants being women, the extent to which the findings would be applicable to males, again, is stage and but all participants were women with the same type and stage of cancer from one hospital. So the same type and stage of cancer from one hospital. So yeah, there's a good thing to this and a bad thing to this as well. The good thing is standardization. The bad thing is the extent to which you can apply the findings uh, to number one, males is questionable. Number two, to people who have other type of cancer or other stage of cancer or from any other hospital. It's again questionable. That's a flaw. This is a strength because it controls confounding variables such as type and severity of illness. However, it also limits generalizability as the findings may not apply to men or people with other conditions. I just explained that to you. So participants were randomly allocated to conditions, which is again uh, a good sign. Participants were, how do we do this? Yeah. So participants were randomly assigned, allocated to conditions, which increases the validity. This increases the validity of the research by reducing participant bias. How is it that it is improving the validity of the research by reducing participant bias? The inclusion of control group is or should also be considered as a strength, as it allows for clear comparison, improving the reliability of the research. So comparison becomes easier for you, which eventually helps you add on to the reliability of the research. The use of self-report measures was practical and they were quick and not too demanding for patients undergoing radiotherapy. It was just 30 minutes, if you remember. So here you go. They were quick, which is a good thing. And the use of closed questions and Likert scales allowed research to collect quantitative data. Quantitative data, by now everyone should know, helps you with comparisons easier in an easier manner. It helps you with better analysis. However, a limitation is that these measures do not collect qualitative data. So collecting quantitative data is a good thing, but not having qualitative data is, again, does not help you understand the whys and hows. So detailed personal experiences were not explored. In terms of application to everyday life, the findings were very useful. The study showed that relaxation and imagery can improve mood in cancer patients. Meaning these techniques can be recommended to help patients manage stress. Reducing stress may also help patients cope better with treatment and improve their overall well-being. So taking this ahead, if we talk about the nomothetic approach here, the study by Bridge et al. Mainly takes a nomothetic approach because it focuses. Now, I'd like to assume we all know the difference between nomothetic and idiographic approach. Nomothetic, the extent to which the findings are applicable to more people, a wider population. Idiographic focuses more on individuals and are usually used in case studies. So the study by Bridge et al. Mainly takes a nomothetic approach because it focuses on identifying general patterns across large groups of participants using standardized questionnaires and statistical analysis, which again is a good thing. you can apply the findings better. This allows researchers to make general conclusions about the effectiveness of relaxation and imagery. However, stress and coping are highly individual differences. As so, an idiographic approach such as interviews or case studies would provide deeper insight into how different patients personally experience stress and respond to their techniques. Therefore, while the nomotherapy approach increases generalizability, an idiographic approach could improve understanding of individual differences in stress management. I just wanted you to know this. Number two, if we talk about a comparison, if you try to figure out, the extent to which this there were situation factors that mattered or individual differences, the study mainly supports a situational explanation of behavior as it shows that stress levels can be reduced through external factors such as relaxation and imagery. We are referring to external factors over here, and the two external factors that we're referring to, number one, we spoke about relaxation. Number two, we spoke about imagery being used. This suggests that environment and interventions play an important role in managing stress. However, the findings also highlight individual differences as not all participants benefited equally. For example, women with higher initial levels, anger levels showed less improvement. This was a finding there too. This suggests that individual factors such as your personality, your emotional state, also influence how effective the treatment is. Therefore, study demonstrates an interaction between both the individual and situational explanation. If you think this is going to help you and you're sitting listening to me attentively, sure, you can go ahead and take screenshots, the initial context, main theories and explanation, the aim, the study sample, the study design and procedure, and data collection, the results, evaluation continued, and there's more to this as well. So if we talk about a comparison between determinism and free will, where it go here? So the determinism versus free will approach, the study leans towards soft determinism, as it suggests that behavior, that is stress responses, can be influenced by psychological techniques such as relaxation and imagery. This implies that responses to stress are not entirely under free control, but can be shaped by external interventions. So now you know कि एक्सटर्नल फैक्टर्स अफेक्ट कर सकते हैं आपके मूड को, आपके एंजाइटी लेवल्स को, आपके स्ट्रेस लेवल्स को, एंड द एक्सटेंट टू व्हिच योर own self can control it, shape it. Uh, that's not always the case. So at the same time, participants were required to actively engage with the technique, as practicing daily would suggest an element of free will. So let's just say there was someone who chose not to practice this as the researchers expected. In that case, the results wouldn't have been the same. Individuals had some control over how much they participated and how effectively they used the technique. Therefore, the study supports a balanced view between determinism and free will. On the other hand, if we talk about ethics, the study raises some ethical considerations because it involved vulnerable participants. They were cancer patients undergoing treatment. Researchers need to ensure protection from psychological harm, as discussing illness and stress could be distressing for some people. However, the study can also be seen as ethically responsible. The treatments, that is relaxation imagery, were non-invasive and they're potentially beneficial, which again, as hypothesized, turned out to be true. It actually did help patients feel better, meaning participants could directly benefit from taking part. In addition, there was a use of a control group may raise ethical concerns, as some participants did not receive the treatment, but they were still given attention through weekly sessions, which may have reduced potential harm. So this could be used as well. These were some extra points that would help you with evaluating the study better. So before I move on to the stress inoculation therapy part, let me show you a question. So in from May 2024, variant 4.1, if you think you need this, if you think this is going to help you, take screenshots. In the key study by Bridget, all the profile of mood states questionnaire was used to assess the effectiveness of the relaxation imagery treatment programs on stress. Explain why the study is a longitudinal study. The study lasted for 6 weeks. Patients saw two researchers once a week for 6 weeks. Scores were taken by Leeds General Scales and Profile of Mood State at initial stage and again after 6 weeks. Compare the results from total mood disturbance for any two groups. So here you go. You could use this. Again, you've had questions on this particular topic. Yeah, this is question number 5. That was question number 5A. This is question number 5B. Suggest how the results of total mood disturbance could be presented in a graph. Again, application through research methods. Explain two strengths of using a longitudinal study to assess the effectiveness of relaxation and imagery on stress. Strengths of using longitudinal study or a graph. All of this research methods, as I've been saying, paper 4. Planning a study. Plan a study using a semi-structured interview to investigate whether stress inoculations, or this for stress inoculation, we haven't done that as yet. So describe the study by Bridge et al. On relaxation imagery in reducing stress during medical treatment. You get a lot of these marking schemes. They could be really helpful. Yeah. You have the aim, you have the sample, you have the procedure, and you have the results and conclusion. And you have had this question in May, June 2025, variant 3.1. That is Pakistani students. Pakistan is zone 4. You sit for paper 3.2. So you could use this to learn. And again, you could evaluate the study by Bridge et al., including a discussion about field experiments. One more thing that I'd like to bring into your attention. Recently, so in May, June 2025, I want to show you something, and let me take you back to the syllabus. See, initially what the CI used to do was, then CI would give evaluative questions where they would, where the named issue was from here, from initially, this is how it was. But now it's not. See, they were every time I've mentioned this a lot of times earlier too. Relevant issues and debates and methodology for this topic include and is not restricted to. So the question that you have, the question that was showing you in from May June 2025 variant 3.1, the named issue there was experiment. In fact, being a little more specific here, this was, where did it go? Yeah. So they, being more specific, they want you to write down about field experiment. This was a field experiment. There were real patients. Here, the named issue. Application to everyday life. Individual and situation explanation, generalization from findings. Determinism versus free will. And there are some other points that could be used too. And again, in November 2025, variant 4.1, the key study by Bridge et al. On reducing stress during medical treatment divided the female participants into two experimental groups and one control group. Outline the procedure followed by the relaxation plus imagery experimental group. Outline the experimental design that was used. Suggest one problem if a different experimental design was used in this study. Explain one strength and one weakness of using a sample of female participants in studies on reducing stress. So yeah. Now, let's take you back and let's focus on the third bullet that was there. The third bullet that you had here was stress inoculation training. And stress inoculation training is this is not this is when you're trying to prevent stress before happening, and when you're trying to train participants so that whenever in life they are, or they're experiencing stress, or they go through, or they come across a situation which could be stressful, potentially stressful, they know how to react, and this training would help them respond to stressful situations better. So we need to know the three phases of stress inoculation training. This stress inoculation training this idea was initiated by Mission Bomb, and Mission Bomb, he's Mission Bomb here. Now, what is stress inoculation training? As you use the word inoculation here, inoculation हम किसे कह रहे हैं? जब हम inoculation का word यहाँ पे use कर रहे हैं, तो हम जिस तरीके से वैक्सीनेशन लगाते हैं, स्ट्रेस होने से पहले आप किसी को ट्रेन कर रहे हैं. One way to prevent stress is through stress inoculation training, a type of cognitive behavioral therapy developed by Mission-Baum. Stress inoculation is designed to help people cope better with stress. So you're helping people cope better with stress. The main idea is that if individuals are gradually exposed to increasing levels of stress, they can practice coping strategies and become more resistant to stress over time. So gradually exposing to increasing levels of stress, making them practice coping strategies, eventually resulting in them being more resistant to stress over the passage of time. Stress inoculation training programs are tailored to the individual. That means they're flexible, could customize them, but they usually involve regular weekly sessions. So again, they are demanding to individual differences would affect demanding. They expect you to attend, which can range from around 8 to 40 sessions depending on the person's needs. Stress inoculation training, as we saw it through the syllabus, has three main phases. To begin with, conceptualization. The second one is skill acquisition and rehearsal. And the third one is application and follow through. Now, conceptualization, what exactly is conceptualization? In this stage, the client and therapist work together to understand the source of stress. पहले तो आप source of stress figure out करने की कोशिश करें. The client, the therapist, they both work together and they try figuring out what the source of stress is. The client discusses their experiences and how they currently cope up. The therapist helps the client reframe stress. Remember, we studied that this stress inoculation training is a type of cognitive behavioral therapy. So the client discusses the experiences and how they currently cope up with stress. The therapist helps the client reframe stress as a problem that can be managed. And if you're able to connect this to cognitive restructuring, you'd understand this better. The client also learns that some aspects of a situation can be controlled while others cannot be controlled. The second one is, so this is to be taught to the client that there are some aspects of the situation. There are certain things that are in your control. There are certain things that are not. There are certain things, I mean, as you say, when life gives you lemons, there are certain things, I mean, they're externally affecting you. But then how you are responding to that particular situation is something that can be managed. So number two, skill acquisition and rehearsal. As we speak about skill acquisition and rehearsal, the client learns new coping strategies suited to their situation. These may include problem-solving skills, relaxation techniques, mindfulness, and distraction methods. So these are the different methods that could use. आप नई coping strategies सिखा रहे हैं client को. You're teaching clients how to cope with the situation better. There are different techniques that you're teaching them. Problem solving, there's certain problem solving skills, there are relaxation techniques, mindfulness, distraction methods. These skills are first practiced in a safe environment before being used in a real life situation. Number three, application and follow through. In a final stage, the client applies the skills in real life stressful situations, starting with less stressful scenarios and gradually moving to more challenging ones. Techniques like visualization, and role playing may be used to prepare the client. So in the final stage, the client applies these skills that you taught to them in real life situations. See, initially you make them practice this in safe environments, and then when they're skilled enough, or when the therapist thinks they are they're trained enough, or it's time that they should be tested, then they are made to use this methods in real life situations. So in the final stage, the client applies these skills in real life stressful situations, starting with less stressful scenarios, gradually moving up to more challenging ones. Again, if you remember imaginal desensitization. So, or wait, so gradual exposure therapies, you've studied all of this, even in AS, when we're doing Summit and Silverman. Techniques like visualization and role play may be used to prepare the client well. Now, let's sum this up. Stress inoculation training can be very effective. Stress inoculation training can be very effective because it is tailored to the individual's needs and teaches a range of coping strategies. So, one, you are tailoring it to an individual's needs, it's customized. Number two, you are teaching them a range of different techniques. This allows the person to deal with different types of stress in ways that suit them, and these skills can be used long term throughout life. However, there are limitations that exist as well. A limitation in the stress inoculation training requires a significant time commitment. So, like I said initially, they're demanding, as the skills need to be learned and then practiced over several sessions. Consistency, persistence, discipline, वो सारी चीजें जो आपको preparation के लिए चाहिए, all that you require as a student too. In addition, it may not be effective for everyone. Yes, there are individual differences, as it depends on the individual being motivated and willing to change how they think about and respond to the situation. How they think about and respond to the situation. So, the core idea behind stress inoculation training, like I'd initially said, you need to know what the word inoculation means. Most of you would know. For the ones who did not, vaccination, it's a preventive measure that you're taking. And do we get questions on this? Yes, they're there in front of you. Describe what psychologists have discovered about biofeedback to manage stress and stress inoculation training. Let me take you back to show this to you. See, so this descriptive question that you just saw, in this question, the examiner has used this bullet and this bullet. So the examiners used bullet number one and content from bullet number one and bullet number three together to make a 6-mark question. 3 from here. Oops. So 3 marks from here, 3 marks from here, together 6 marks. And yes, I just show you these questions and the marking schemes. It's just in case if you're interested and you want to take screenshots of this so that you're able to, so that you don't have to look for questions. Here you go. So I received a question that said, was the hypothesis proven? Yes, I showed it to you. Evaluations. Now again, a question from May, June 2024, variant 4.1. Question number 5A, 5B. Question from May, June 2024, planning a study question, variant 4.2. May, June 2024, 4.2 continued. And a little more because this is that 24-mark planning a study question. May, June 2025, variant 3.1. Describe the study by Bridge et al. On relaxation and imagery in reducing stress. So there's specific guidance that the principal examiner has provided the paper checkers. You might as well note this down. if you're getting a question on any key study. And this is what is required for full marks. Here you go. Evaluative question that comes right after the descriptive question that is worth 10 marks on the study by Bridget et al. A question on stress inoculation. Isha has been experiencing stress at work. She worries about whether she will meet deadlines and whether the quality of her work is good enough. Suggest how stress inoculation training could help to reduce Isha's stress at work. So here, the syllabus part, and this is the example. What you should write to score full marks. Here you go. Outline what is meant by the determinism versus free will debate. Explain why free will is important for one way to manage stress. The key study by Bridget et al. I had shown this to you earlier, November 2025, variant 4.1. The most recent paper, November 2025, variant 4.1. A planning and study question again. Plan an experiment to investigate the effectiveness of feedback. Wait a second. Yeah. Plan an experiment to investigate the effectiveness of biofeedback to manage stress in university students. So they are asking you to use an experiment. Planning a study question. So yeah, this brings the third section for the unit stress to an end, and this brings this unit stress to an end. I hope this was helpful. Thank you.